there could be a mass-scale approach. That's, of course, what the NTD community has been doing. But I would like to work with you in my capacity as special advisor to Antonio Guterres to remove the remaining obstacles that you face, whether it's money, whether it's awareness, whether it's the pharmaceutical companies or any other obstacles. I would like to help you remove them. So let me end here by emphasizing the mobilization aspect of this meeting. What precisely is needed now? If you come back to me, I will have opportunities in the next couple of weeks to share your insights in detail with the Secretary General. I will be with the major donors soon. I would like to hear concrete role. Thank you very much.
Sachs, thank you very much. We appreciate your continued commitment and advocacy, and I was noting in the room that people were taking notes in terms of their asks and the types of things that would be helpful in helping move this agenda forward. So Professor Sachs, thank you very much, and have a good remainder of your day, sir. We will move on. Ladies and gentlemen, this morning, for those of you who were here, we heard major commitments made by governments, by NGOs, by industry, commitments that would actually demonstrate the contribution that those entities were ready to make. But we did not have the privilege of hearing from Nigeria. So we have Senator Professor Ayade. I will give the floor to you, sir, as you did not have a chance to share your views this morning, so that you can do so now.
Thank you. I, like most other young African children, were born into a very poor community without access to water, sanitation, and hygiene. Yeah, without access to water or hygiene. But surely, given the circumstance of African situation, obviously, because we all know that 80% of diseases in Africa are water-related. Therefore, water being a major carrier has remained a key challenge, even as we speak today. The question stands, where are we now, and what is the future? Today, as we speak, the predisposing factors have not changed. Africa is still exactly in the same situation. Lack of water. Lack of hygiene. Lack of sanitation. Unfortunately, the situation is not getting better. As African kids continue to find this situation, unfortunately, the situation we have is the introduction of mass drug administration. Of course, that have shown commendable results. Remain very strong. Because there is inadequate political will, because the affected population that depend on these drugs are actually not seen in political cycle as those that are politically relevant enough for you to think of focusing on them. And therefore, you have a situation where you ship in large amounts of drugs, costing millions of dollars, like we've heard this morning, shipped over to these people, and the political structure that requires that will to cascade these drugs down to those who need them most don't do that. What you have, therefore, you have this large amount of money spent, drugs mobilized, moved into Africa to the respective countries, and we have these drugs sitting in. That's come when World Health Organization must recognize the fact that the supply of drugs is not enough in the chain process. There must be a deliberate effort, a clear understanding of developing a structural and normative framework that can guarantee that these drugs distill down to the needs it more. reflect that even as a little child, I saw myself taking my bath. Myself, how did I survive all of this to get to where I am today as governor, professor, senator, and a lawyer? I believe that as I recover with this shame, but I give glory to God, but there are millions of young Africans out there in the same situation that I had 40 years ago. It's my pleasure, it's my prayer that World Health Organization must go with the drugs, must go hand in hand. The first foot has gone into the door. The second must go to actually drive these drugs to the core areas of need. Thank you.
Thank you. Senator Ayade. Thank you. Ladies and gentlemen, we're going to begin to dive in the specific thematics that were identified for this afternoon's session. And there are three parts to it. Part one is really focusing on progress of 2020 and the changing NTD landscape, and I will be probing various folks in the room about specific things that really refer to that landscape and looking again beyond 2020. The second part is going to be about the role of universal health coverage and the SDGs in that changing landscape. And the third scene is really going to be focusing on NTD financing in the area of UHC and the SDGs. Now, to frame the first part, I'm going to be calling on Mathieu Bengert. And what Mathieu is going to share with us and his colleague a little later on is really drawn from the NTD, the fourth NTD report, which was being released today. So Mathieu, the floor is yours. Please help us to set the scene before we direct questions to participants. Mathieu.
Thank you, Daniel. Ladies and gentlemen, the fourth report reflects on progress made in eliminating and controlling NTDs towards WHO's 2020 roadmap targets. Preventive chemotherapy was supported in the African region by mapping out more than 85% of districts in countries at risk. This facilitated an increase in global coverage such that almost 1 billion people were treated in 2015. Innovative and intensive disease management has led to historically low numbers of cases of sleeping sickness and visceral leishmaniasis. An integrated approach to the skin-related NTDs will further strengthen surveillance and clinical management for these diseases. Vector ecology and management is part of the continued WHO response to the Zika outbreak. Moving forward from this crisis, the global vector control response will integrate efforts against dengue, Zika, chikungunya, and other Aedes or vector-borne diseases. Veterinary public health has been strengthened by the collaboration of the WHO, the Food and Agriculture Organization, and the International Organization for Animal Health. Their joint vaccine bank has enabled delivery of 8 million doses of rabies vaccine. Finally, a joint strategy with the WASH sector means that investments are being targeted where they will have the greatest impact. Ladies and gentlemen, the fourth report also considers the challenges ahead in eliminating NTDs. As we move towards the later stages of elimination and scale down interventions for some diseases, we need to ensure continuity for others. More effort will be required in insecure zones and otherwise hard-to-reach areas. Emphasis will need to be placed on surveillance to target pockets of high transmission and prevent resurgence. The toolbox of NTD interventions may have to adapt, with greater use of non-medical interventions such as vector control, veterinary public health, and WASH. The interventions themselves may also need to adapt. Resistance to insecticides, for example, calls for the evaluation and deployment of new vector-controlled tools. While the NTD community remains firmly committed to targets for 2020, it is already considering targets leading up to 2030. 0 incidents of sleeping sickness by 2030. 0 human deaths from dog-transmitted rabies by 2030, and 0 deaths from dengue by 2030. Eliminating NTDs may mean eliminating transmission or elimination as a public health threat. This will be disease-specific. These and other challenges are being faced by those around the table and everyone in this room.
Thank you, Mr. Bengert. I'm now going to be going to Dr. Moeti. Dr. Moeti, as the Regional Director for the African Regional Office, we heard this morning of your participation and leadership in the ESPN project, that is the Expanded Special Project for NTDs. And with the launch of ESPN, your region